Hi guys, this is Professor Elliott. This is chapter 19, and these are adrenergic blocking drugs that we'll talk about. So adrenergic drugs are what we talked about in the prior chapter, in chapter 18. And if you remember, these are drugs that work on the sympathetic nervous system. In 18, we talked about adrenergic agonists. So in 19, we're going to talk about adrenergic antagonists. If you will remember from prior lectures, we talked about antagonists being blockers. These drugs will fit into the receptor and they will block it, preventing anything else from acting in this receptor. Another word for adrenergic antagonists is sympatholytics. We don't use that word too much, but I just want you to recognize it. In the last chapter, we talked about alpha receptors and beta receptors. If you remember, we talked about alpha type 1, alpha type 2, beta type 1, and beta type 2. So the alpha blocker that we talk about is alpha 1. If you remember, alpha 1 was responsible for vasoconstriction. If we're blocking alpha 1, we're going to have the opposite effect. In this case, we're going to see vasodilation. That is going to be the biggest effect at our alpha 1 blockade. Some other things that we may see are meiosis, which is smaller pupils, and we can see reduced smooth muscle tone in the bladder and the prostate. So I want you to think about this. What conditions would we treat with vasodilation? So we would treat hypertension. If we're dilating the vessels, they're getting bigger, and that is going to reduce the pressure. So if we have a bigger blood vessel, it's going to reduce the blood pressure. So something we may treat would be hypertension or high blood pressure. So let's talk about indications. Hypertension due to the vasodilation at the alpha 1 blockade. We can treat benign prostatic hyperplasia. Benign prostatic hyperplasia, I like to just think of as big prostate. As men get older, they're more likely to have an enlarged prostate. That enlarged prostate causes urinary retention. We can give alpha 1 blockers to help reduce that urinary retention and cause increased urination. A pheochromocytoma. A pheochromocytoma we talked about in the prior chapter. This is a tumor on the adrenal gland that produces catecholamines. Now remember, our catecholamines are norepinephrine, epinephrine, and dopamine. So we could use an alpha 1 blocker to reduce that catecholamine surge. We'll talk about Raynaud's, acrocyanosis, and frostbite, but the mechanism of action with these drugs is vasodilation, which allows more blood to get typically to the fingertips or toes. And then we'll talk about reversing extravasation. Extravasation is when you're giving a medication intravenously and it leaks out into the tissue around the vein. In some circumstances, this tissue can be very caustic or damaging to the tissue around the vessel. So we can use an alpha 1 blocker to reverse that extravasation. Okay, so let's talk about BPH, or benign prostatic hyperplasia. The mechanism of action here is reducing that smooth muscle contraction around the bladder neck and prostatic portion of the urethra. If you look at the picture on the right, the prostate is squeezing that urethra and preventing the urine from leaving the bladder. So this is going to reduce that smooth muscle contraction and allow the urine to leave the body. Okay. Now the pheochromocytoma. So this is the tumor on the adrenal gland. It secretes norepinephrine as well as other catecholamines. So the alpha blocker, when we give it, it's going to prevent the hypertension. Now, how is it preventing the hypertension? It's going to block the alpha receptors, which is going to have the vasodilatory effect. The vessels are going to get bigger, or it's going to prevent the vessels from constricting. Okay. So Raynaud's, acrocyanosis, and frostbite, really the mechanism of these things happening are vasoconstriction. The picture down below is Raynaud's, which is a condition where cold or stress can cause vasoconstriction in the fingertips. We'll see really white fingertips because the vessels are so constricted, we're not getting adequate blood flow. So by giving an alpha blocker, we can reduce the vasoconstriction, which allows the blood to get up to the fingertips. All right, here's a picture of an extravasation. Norepinephrine and dopamine, if you remember, cause vasoconstriction. Now, what happens if we're constricting the blood vessels too much? Blood can't get through, right? The vessels are so small, we can't get blood and oxygen through. Well, if we're not getting blood and oxygen through, the tissue will die. The tissue needs blood and oxygen. That makes sense. So if our vessels are so small, we can't get blood and oxygen through. So we can have tissue necrosis. So here is an example of a norepinephrine extravasation. So if you're giving IV norepinephrine, what are you going to want to do? You're going to want to monitor the IV site frequently. If this starts to occur, we can remove the IV, treat it right away. There's been reports where people lose limbs due to this extravasation. All right, some contraindications here. It's just really a lot of diseases of systems. So peripheral vascular disease, right? Our blood vessels, our veins, typically in our legs, are not working very well. If we dilate them, they're not going to work. They're going to work less well. Hepatic and renal disease, coronary artery disease, peptic ulcer disease, and sepsis, which is that big blood infection or blood pressure drops. Here's a picture about alpha adrenergic antagonists, alpha blockers, that little picture up at the top, kind of that swirl where it says blockers, that's an alpha symbol. So some things that can happen, some adverse effects, we can get orthostatic hypotension, vertigo, sexual dysfunction, and palpitations, and we'll talk about some of these. One of the big adverse effects that is important to know is something called the first dose phenomenon. So this is a term, so it's first dose phenomenon. So you think, okay, something's happening with the first dose. So what is happening with the first dose of medication? When the first dose phenomenon occurs, we see a quick, severe blood pressure drop after administration of the first dose of an alpha adrenergic blocker. Now, we know if our blood pressure falls quickly, we could pass out or fall. Along with this, we can see orthostatic hypotension. We know that's a big safety issue. So again, we don't want the patient to fall. So we'll have our patients get up slowly from a supine position. Some other things that can happen are dizziness, headache, and constipation. So whenever we have adverse effects, we need to educate our patient about it. So that's part of the nursing process. When we're giving a medication, we have to watch out for what we're giving and know all of the adverse effects, but we also want to teach our patient about those adverse effects. A lot of these medications are PO. The patient is going to take them at home. So we're not going to be able to remind them every time they take it that, oh, you may fall, don't get up quickly. So we need to teach them. Now, how are we going to evaluate effectiveness of our teaching? Teach-back method is a very good way to evaluate the effectiveness. Okay, so two alpha blockers to talk about are phentolamine and tamsulosin. Phentolamine is a medication that is a non-selective. Do you remember what non-selective means? So non-selective means that it doesn't just work on one specific receptor, but it works on more than one receptor. It's non-selective. This medication can treat high blood pressure, but it's also what we use to diagnose that pheochromocytoma. So a patient may come in young, healthy, they have really high blood pressure, 180 over 120. You think, this isn't normal. Somebody in their 60s who smokes, overweight, okay, I could see that blood pressure. Somebody young, this doesn't make sense. So you may think, okay, well, I heard about that pheochromocytoma thing. I wonder if that's it. So a medication that we give to diagnose that condition is phentolamine. For this medication, we would give this patient one IV dose of phentolamine, and we would monitor their blood pressure. And if the blood pressure quickly returns to normal, the patient most likely has the pheochromocytoma. So this would be something we use to diagnose that tumor. Remember, the pheochromocytoma is a tumor on the adrenal gland.